Hi, family and friends. It's Girl Velta. Catch up on what's been going on. I told you I went to school to be a nurse assistant. I passed, got the job. Patients love me. I love them, and everything was going fine. So I got in a car wreck, and because I normally keep up with my mammogram, so when I got in the car wreck, I just go ahead and when I got my mammogram schedule, so I took it and a pap smear. So they called me about my pap smear and they said it was fine. So I said cool. So they didn't say anything to me about my mammogram. So me assuming, don't assume y'all, I assumed everything was fine because they would have called me. Okay. So that was in January of this year. All right. So it's like 2026. So anyway, went to the doctor. Like I said, I got the mammogram in January. Didn't hear anything. So everything, you believe that no news is good news. Not necessarily. So anyways, I went, like I said, in January. So I was like doing a self exam, you know, that they told us to do younger, but I was doing it. I felt a knot. So I'm like getting freaked out or whatever. So I called and get scheduled an appointment, see what the mammogram say. So went in March and I told them I had found a lump on my left side. So they was like, we're gonna have to get a test done, a mammogram. I'm like, I already did a mammogram like in January. They said, oh, really? The doctor. He said, oh, really? He said, I'm going to ask the nurse. So I heard him ask the nurse, what about her mammogram? She said she did in January. The nurse replied, oh, we never looked at that yet. Yeah, didn't know what it said. I know. So messed up. So then they said, we're going to have to schedule another one. All right, fine, whatever. So I scheduled another one. And I showed them what the lump was, whatever, and they did a mammogram. They did a more thorough one this time, though. Because, they put your breast like in this little clamp, and then they squeezed it down, then they took the x-rays. But this time, they did clamp this side, top, they did more thorough than they did before. It was just like click, click, and that's it. So, but anyway, they saw the lump in the end. So I went to a doctor in Winsboro, Louisiana, cancer doctor. So did some more tests, another semi mammogram, and they kept sending me to the doctor in Winsboro, Louisiana, which sent me to the doctor in Baton Rouge, Louisiana. It was like they was passing me off on each other to get more insurance. That's what I looked at because they didn't give me no treatment for the cancer or nothing. They just kept passing me and telling me what they're gonna plan to do. So it was like I'm not exaggerating. These people took me sitting appointment, but it was like 5 6 months of nothingness. Then they did what they call a biopsy. Y'all don't want that, y'all. Oh Lord. But anyway, the biopsy consists of a long needle, and they push it through all your fat, your lean, all the way through, and then you feel like this clamping thing. And when they clamp, they cut the meat inside of some of your tissue, and they're pulling it out. I remember looking when they was pulling it out. I saw the like the skin, well, lean, whatever it was like shaking, but that hurt so bad. Anyway, so let's speed it up. They said I don't have. They called me and they told me I don't have cancer in my gland. So I'm like, I don't know too much about cancer and where it be and whatever. So when they called me and said you don't have cancer in your glands, I said okay, cool, fine. Whew, right, wrong. The next day, they called me back and told me I don't have it in my glands, but I have it in my breast tissue. So it's up, seesaw, up and down emotions. So anyway, I went to the doctor in Baton Rouge, the one I was going to, and she did a biopsy. Okay, so she did the biopsy. It hurt, same thing, it hurt. But anyway, and then she said that they see the lump, they see something in my breast on the left, but there's some kind of something smidge. They didn't know what it was on my right side. So I'm like, oh, both breasts. And so I'm gonna tell you right off the top, It freaks you out when you first hear stuff like this. But I had to come to grips with how bad this could be, how bad this could get. And I said, if I have cancer in this the breast and it's moving, spreading, whatever, I was gonna make the decision to cut it off because I want to live, and I can live without breast. Okay, so that was the decision I made. So they kept, like I said, dangling me back and forth. So I go and I have, like I said, the doctor in Baton Rouge. She did the biopsy, right? So she telling me that I need to wait for a couple weeks for they to give me some more, what results. All right. So she give me the biopsy and she tell me I'm gonna need port surgery. Now I didn't know nothing about none of this. So the port thing they're gonna put in my chest, which they did is right here. You can see it. Okay. Now this one, not that one. It was right here. So they put the port here. I didn't have this one. This one, right here, right. So she like it was and June probably like the 19th or the 20th, 25. Okay. And 2 days I was like hurting, whatever. I was taking fine. It's the soreness, from the surgery. Okay, cool. Then I started having these pains in my side, and I was trying to get comfortable sleeping, but I couldn't. It kept. I had to keep moving. I couldn't be comfortable. When I got comfortable, after a while, I couldn't breathe. It's, yeah, I couldn't breathe. I was breathing. It was hard for me to breathe. And so my son, and got two of them here. They was talking to me about what these symptoms I had and what was going on because I was hurting so bad, y'all. I even told myself it probably was a blood infection because it was hurting down here too. Not thinking anything else but that. So anyway, they said that the port had malfunctioned. So around about that fourth day, I had to call the ambulance. I had to go to the hospital. And then when I got there, they put me in this whole mess, oxygen mask. I couldn't breathe. It was so terrible. So when they sent me to the hospital, the ambulance brought me to what you call Ferry, Louisiana. Okay, so they tell me they don't have the equipment and stuff to treat me. So they had to fly me to Alexandria, Louisiana. And like I said, it was so much pain here, and I couldn't sleep. And then I would wake up feeling like I was underwater. Oh my God, drowning. My breath was getting shorter and shorter. Okay. So I called the doctor and I asked him, the one in Winsboro. I told him I didn't tell my symptoms at first. I told him I'm having trouble pain, and I said, "Well, can y'all, help me if I come to you all, right?" And then I told him she asked me for my symptoms or whatever. So I told her, can't breathe, wake up, just can't breathe. Everything was hurting so bad. My side, I couldn't sleep on my side. I couldn't even lay on my side. I'm sitting up on. I still got pillows all behind me now, y'all. And it's been a minute. So anyway, so what they told me was that the port had malfunction, and my lungs was full of bloody water. The bloody fluid inside was draining on my lungs, and that's what had happened. My lungs had collapsed. Well, my right lung had collapsed. Okay, so I'm in the hospital, and I'm telling them, why don't you get the lady who put it in, the doctor that put the port in, and come take it out. They said she's on vacation. Yeah, and she's not affiliated with this hospital in Alexandria because she's from Baton Rouge area. So I had to wait till they find somebody, a heart surgeon, that's able to not pencil me in, I guess, or whatever. So, because he's busy, I understand that. So I had to wait. So, like a week, and then they would tell me, yeah, the doctor's coming in. He's going to, and he's going to do the surgery. I said, okay, fine. Because I was like all depressed. I was like, just pain, and they're not helping me. And then they asked me what I was on, like medicine-wise. And one thing I do not want to do is get hooked on these so strong medicines they say they put you on and whatever. So I had saw a program on TV where it's called Jiggers. I don't know if you know whether it's on YouTube, but it's like this. Anyway, they dig little things out of people's feet, little insects, whatever, and they give them Lanacane. They rub the lidocaine on them, arms, hand, wherever the infections are. They use that for pain. So that's what I suggested to them to give me some lidocaine, you know, because they were hurting and I rub on there so it would help. And then under my breast, where they had a tube under here, I had a tube in my nose, I had a tube down my throat. It was, it was terrible. And so they had my when I first went, got me back in the hospital. When they finally got me seen by the doctor, they were telling me they were gonna get me seen by the doctor, but I can't eat anything or drink. So it's first off, the first 5 days of nothingness. They wouldn't even give me water. Say it's gonna, you know, they were saying it would like it would be bad, and I could like, you know, I don't know what they call the word, but anyway, I could choke on aspiration. That's what they call it, aspirate. Anyway, so I'm hungry. Yeah, and so they said then it's like 6 day I'm in the hospital. Then they said, oh yeah, the doctor. I said they said the doctor was coming to do the surgery, so what's what's taking so long? And they said, no, the doctor got to see you first and everything before you even do the surgery. Everything that I had in my head about the doctor's coming within a couple of days, whatever, then you get unbusy, piss me, and then I can get all this pain and these tubes everywhere. So they're telling me he hadn't even seen me yet. So how he was gonna get the surgery on me if he had never even seen me, he had never met me. I got so depressed. I was just upset, so upset. So anyway, he finally came. Altogether, I was in there about 10 days, and he finally came and did the surgery. That's why I told him all that tubes was everywhere when I got out. And I was just so sad and so much pain. I was scared, y'all. I ain't even trying to fake. I was scared because I can't breathe. I can't walk. They put me on oxygen. I ain't been on nothing, y'all. Cause I went back to school, like I said, and became a CNA. And I was doing my job with my patients. I had to move them around and stuff and clean them and all that. I was doing fine. I never had no oxygen. I never had to have no walker. Like I said, it was hard job. But the things I went through and share, because who knows, I might have somebody that's not doing their mammogram. You know what I mean? And it probably would have been worse for me if I had been like every 4 years, or some people just don't do it. But it is important that you get them on a regular, because I think I would probably be worse off than I am if I hadn't been keeping up with it like at least yearly, at least once a year. So I encourage y'all get your mammograms on a regular basis, please. You don't want to go through this. So did the surgery. Doctor called me, the one who put the port in. Uh, the port. Oh, I'll tell you, explain what the port is. The port goes in here, and what they do is they got this chemo that they put through the port. That's how they get you chemo treatment. Oh, I hadn't explained that to you at first, but anyway, that's what they do. So they tell me she come in. She calls me. She don't come in. She calls me. She say, "Hey," I said, "Hello," and she was like, "How that breathing treatment working for you? How the oxygen working for you?" Lord knows in my head I said some things, but I didn't. Because you hear it, don't mean you have to come out your mouth with it. I'm in a bad situation. Don't make it work. So anyway, I said fine. I was like, and he said, you don't come back and see me until August. In my head again, I'm like, I'm not coming back and see you at all. You almost killed me. Anyway, so I got out with most of the tubes came out. Long tube, Lord have mercy. And had one left, the one under my breast right here, where the lungs had collapsed. They were still draining all that fluid. I even asked them to show it to me when they finished. They said, you want to see it? I said, yes, ma'am, I want to see it. So you know the pictures that you buy for lemonade or whatever? It was this much, two of those and a half full of fluid. I finally got it. Finally got out of the hospital, people. Oh, Lord have mercy. Everything changed. The doctors were acting all like, like nonchalant, like I'm overreacting, but I'm like, y'all done put me in the hospital and everything, and y'all still not treating me for this cancer. So it was like, I think it was like July 17th, 25. They had an appointment. After I got out of the hospital, I had an appointment to go see my doctor at one Winsburg. And so first I asked him, I said, what happened? We don't know these things happen. And I'm like, no, you gotta do better than that. But he came back again to Elliot because he's affiliated with them. He can wait on me or whatever, but the other doctor couldn't. Okay, anyway, so he was like putting off on what really happened. And he finally told me that my lungs collapsed because of all the heavy fluid was on it. And he was telling me, so like, yeah, because I was gonna we gonna start your chemo on, June the 26th. I went to the hospital, y'all, June 26th, I mean, June 25th. So he told me the next day they was gonna do my chemo because that's what he had been telling me. So then I went there on the 17th of July, and they said, Doctor be with you in 5 minutes. I'm like, cool, whatever. So they put me in the room, like they don't do. They put you in the room, doctor, and then they come in there, whatever. So I'm waiting for the doctor to walk in. So they bring me in this room with a lady sitting at her desk. I'm like, that never happened. So anyway, she was like talking. She said, hey, how you doing? I said, uh-huh. And then she said, the electricity is off in Africa. Okay, why are you telling me about some electricity off in Africa? We over here in Louisiana. I didn't understand that. It was just crazy to me. So anyway, so a few minutes later, she hands me a phone. Hello? It's him. He told me, yeah, we're gonna have to. I said, no. He said we're gonna have to do your what did he say? Surgery? No, not surgery. He said we're gonna have to start doing your chemo. So we're gonna have to get you ready for chemo. I'm like, and I said, okay, fine, because you was gonna give me chemo on the 26th. Mm-hmm. So he said, yeah, but we got to get that approved by your insurance, Medicaid, whatever. I said, get it approved. You told me you was going to do my chemo on the 26th, the day after I was in the hospital, but you had never even got permission from my insurance. You never even called the insurance, so now we got to wait till the insurance accepts it and probably be like, what, 23rd day? You lied to me. You told me you was going to give me chemo on the 26th. You lied. I ain't go back to them after that. So I went to another doctor. I had called around. I went to Monroe, Louisiana. That's where I had went when I had my open heart surgery. So Monroe, they're really good. And it's Glenwood Hospital, and they took great care of me. So anyway, I was done with the doctor and the one in Baton Rouge, her too. And I said, I'm not going to the other. I'm not going. Didn't call me all they want. I'm not going there because you almost killed me. So I'm gonna let you go finish the job. No, baby. So anyway, I called around and Monroe cancer's place. They called me and gave me an appointment. So by this time it's August, and they had never gave me no treatment at all. So, but what happened was the the hospital in Monroe, they gave me an appointment on August 11th. Yeah, August 11th, I had told them they looked at my files and they knew the backstory about how long I had any treatment, and they gave me an appointment like on the 11th. So on the 11th, I did the appointment, they did physicals and stuff, and show the difference. So on the 11th, they saw me, and then she said, "But since you haven't had any treatment, we're not gonna let you leave here without starting you on some treatment." You see what I'm saying? One day, but y'all done wait like 7, 8 months, and still hadn't did anything. Like I said, I guess y'all hadn't got enough money from my insurance company yet, nurse or whatever. So I want to catch y'all up and what's going on with me, and it's been rough. I ain't been able to go back to work and miss my patients too, and on oxygen and all this other stuff there. Anyway, my doctors I've had, they've been really nice and good, and they had this thing that go to chemo. I started going to chemo every Monday. So they this was, like I said, the first port they put in that messed up. messed me up all that. And so this the doctor on the doctor Monroe, they put this one. It's another one, totally different, like night and day. This one started hurting within 2 days. Then the fluid and all this other stuff, can't breathe. This one, it was sore, but it wasn't sore. I mean, it was like night and day. The difference between that one and this one. So anyway, I've been getting chemo every Monday. It was like 6 weeks. So I had to go there and I sit there and they put the tube and goes right in here. They give me the chemo. So I've had my chemo, like I said, 6 weeks. And at the end of chemo, they got this thing they do. They uh they let you ring a bell and they show you how much they appreciate you and wish you could. It's a little thing, but it meant a lot. I liked it. So so far, I've had all my chemo, and they're starting me on radiation. So I have to start on that probably next week because the date is like the 22nd of February, 26th. And I'll go back and I start my radiation. But the thing is, tomorrow I go back to the doctor, y'all. Okay. And I don't know because they did a pathology, report, whatever examination. They took the more tissue and they send it off to pathology so they can tell me if after all these months, if the cancer is stable, moved. I don't know any of this yet. I've been praying, y'all. Pray for me. I've been praying. And tomorrow I know what's what. They're not knowing is really like it's nerve wracking. It really is. And oh yeah, I lost all my hair. It's okay. I still sport it. Yeah, I'm gonna be me. Okay. But anyway, I'll be back. I tell you what happened with my results for tomorrow. How my radiation and stuff gonna be going and all that. And I live in Waterproof, Louisiana, but I'm gonna move to Monroe to be closer to my doctors. Yeah. So thank y'all for listening. I appreciate y'all. I do. And I believe I'm gonna be all right, y'all. But I'm glad y'all here with me and y'all going through this with me. I appreciate y'all. I do. All right, my babies. I'll let y'all know later.